When one thinks, feels, or behaves in a way that causes a problem in the way he or she functions, then he or she has a personality disorder. Our personality makes us unique individuals and distinguishes us from other people. It is the way we think, feel, and act. Our personality is influenced by a number of factors, which include inherited characteristics, life's experiences, and environmental factors. When one thinks, feels, or behaves in a way that causes a problem in the way he or she functions, then he or she has a personality disorder. Personality disorders are conditions in which an individual differs significantly from an average person in thoughts, feelings, perception, and relationship with others. There are several types of personality disorders, one of which is the narcissistic personality disorder, which I would love to enlighten us on today on Relax Circle. Welcome to Relax Circle. I'm Ruth Bella Ihide, unburdening women of past heart, guilt, and shame. Don't forget to hit the like button, comment, share, and please subscribe to this channel so we can build a bigger community of a healthier, productive, and more confident women. Narcissistic personality disorder is a condition in which people have an unrealistic high sense of their own importance. They need and seek too much attention, care, and admiration from others, and may lack the ability to understand or even care about the feelings of others. A person with the narcissistic personality disorder is known as a narcissist, and this condition can also be referred to as narcissism. A narcissist is self conceited and has an inflated sense of self importance. Did you notice the self in the sentence? A narcissist has the me, myself, and I kind of attitude. The selfish, domineering, overbearing, and lack empathy for others. It's just about themselves. Me, myself, I. They have no room for another. They don't even care about other people, how they feel. They just want everything. Everything revolves around them. While it is important to have a high sense of self worth or self esteem, a narcissistic person acts superior to others to make up for a fragile sense of self worth. This actually makes it difficult for them to get along with others or even have a genuine self worth. Having a sense of self worth means that you love and value yourself. It is important to have a high sense of self worth because it impacts everything you do from your relationship to how you feel, how you think, how you work, how you act, how others view you, and how you view others. A person with a high sense of self worth respects others' opinion, is assertive, and is able to give and take constructive criticism. A person with a narcissistic personality disorder, on the other hand, acts superior to others, belittles others, doesn't care about the opinion of others, has the know it all attitude, is aggressive, can take or handle criticism, but fond of giving destructive criticism. Let's look at the causes of narcissistic personality disorder. So, in place of narcissistic personality disorder, permit me to use the acronym NPD. NPD is an acronym for narcissistic personality disorder. So, the exact cause of NPD is unknown, but a number of factors are responsible, which include childhood trauma, you know, difficult childhood, painful childhood experiences, which lingered, which it could be parental neglect or rejection. It could also be an abuse, which may have been physical, sexual, or even verbal, psychological trauma or neurological factors, overprotecting parenting styles. Some parents are so overprotective of their children, especially those parents who have just one or two kids. Don't get me wrong, I'm not saying you shouldn't be protective of your children. It is a responsibility as a parent, in fact, to protect your child. But you don't do it in a way that will have an adverse effect on that child. Remember that this child is growing, and whatever this child learns as a child, will affect the adult that child will eventually become. Some parents are so protective of their children that they train them up in a way that gives them the impression that others are inferior to them and that they are superior to others. It's good to inculcate self importance, self assurance values in your children. It's good to be self assured. It's good to have a high sense of self worth or self esteem, as I stated earlier. But don't do it to the detriment of the child in question. Make the child understand the importance of balance. That in as much as they are important, others are important as well. Some parents teach their children to be disrespectful to others just to prove superiority, which is very, very wrong. Other factors could be genetic or environmental. What are the signs of NPD? What are the signs that you may have a narcissistic personality disorder? What are the things to look out for to check so you know if you're actually a narcissist? You may be a narcissist and you're not even aware because you think that what you're doing is normal. So come with me as we, look at the signs of narcissistic personality disorder. One of the signs is overinflated sense of self-worth. Everything is all about you. You're better than others. You have constant thoughts about being more powerful, more beautiful, more lovable, smarter, more attractive than other people. You feel superior to others, and there's this desire to associate with people of a higher social strata than you are because you feel anyone below your social strata is not up to your standard. So you have to associate with people of higher status in the society just to prove your superiority to others. You have a high sense of entitlement. People must give to you what you want because you think you are entitled to it. NPD causes problems in many areas of life, such as trouble maintaining positive relationships, difficulties managing emotions and behavior, problems dealing with stress and adapting to changes, avoidance of responsibilities in which they would not be given the desired attention, recognition, or accolade, secret fear of shame and humiliation, feeling of insecurity. They may also suffer from anorexia, which is an eating disorder, which could be as a result of starving themselves in an attempt to maintain beauty, sadness, depression, and contempt. Due to their hurtful, resentful, rude, bossy, and overbearing attitude, as I stated earlier, they may find it difficult to keep friends because others want to enjoy being around them. So they get lonely, depressed, sometimes suicidal attempts. They may actually commit suicide if care is not taken. Drug and substance abuse. Due to the fact that the exact cause of narcissism or narcissistic personality disorder is unknown, there is no known way to prevent the disorder, but it can be managed. One of the ways of managing MPD is by psychotherapy, that is, talking to a mental health therapist, which can also be referred to as talk therapy. It includes includes discussion about your thoughts, feelings, and behavior. There are different types of psychotherapy, but your mental health therapist will determine the best type of therapy to employ. Depending on the severity of the disorder or the duration, treatment may require months or even years. Medications may also be prescribed when necessary. As much as possible, avoid self prescription. Cheers to a healthy womanhood.